Question: what are the common mechanisms of spine injuries?
Answer: spine injuries can result from falls, motor vehicle accidents, sports injuries, and violent trauma.
Question: what is the difference between a stable and an unstable spine injury?
Answer: stable spine injuries maintain the stability of the spinal column, while unstable injuries involve disruption of spinal stability, increasing the risk of further damage.
Question: how are spine injuries classified based on their anatomical location? Answer: spine injuries are classified as cervical, thoracic, lumbar, or sacral based on their location along the spinal column. Question: what is the significance of cervical spine injuries?
Answer: cervical spine injuries can lead to neurological deficits, respiratory compromise, and affect upper extremity function. Question: how are spine injuries evaluated in the initial assessment? Answer: initial assessment involves the ABCDE approach: airway, breathing, circulation, disability, exposure, along with a thorough neurological evaluation.
Question: what is the role of imaging in diagnosing spine injuries?
Answer: imaging, such as X-rays, CT scans, and MRIs, helps visualize spine fractures, dislocations, and soft tissue injuries. Question: what is spinal shock? Answer: spinal shock is a temporary loss of neurological function below the level of injury, often causing flaccid paralysis, loss of reflexes, and sensory deficits.
Question: how is neurogenic shock different from spinal shock?
Answer: neurogenic shock is a type of distributive shock caused by the loss of sympathetic tone after spinal cord injury, leading to hypotension and bradycardia.
Question: what is the significance of thoracic spine injuries?
Answer: thoracic spine injuries can affect trunk stability, respiratory function, and the risk of paraplegia.
Question: what are the key considerations in managing spine injuries in the pre-hospital setting?
Answer: maintaining spinal immobilization, addressing airway and breathing issues, and avoiding movements that worsen spinal stability are crucial.
Question: how is the level of neurological injury assessed in spine injuries?
Answer: the American Spinal Injury Association, ASIA, impairment scale assesses sensory and motor function to determine the level and severity of spinal cord injury.
Question: what is the role of cervical collars in managing spine injuries?
Answer: cervical collars provide external stabilization to limit movement of the cervical spine and prevent further injury.
Question: how are cervical spine injuries managed in the hospital setting? Answer: immobilization, traction, and surgical stabilization may be considered based on the type and severity of the cervical spine injury. Question: what is the significance of lumbar spine injuries?
Answer: lumbar spine injuries can lead to lower extremity motor deficits and affect bowel and bladder function.
Question: what are the types of spine fractures?
Answer: spine fractures can be classified as compression, burst, flexion distraction, and fracture dislocation, among others.
Question: what is the role of spinal orthoses, braces, in managing spine injuries?
Answer: spinal orthoses provide external support to injured vertebrae and help maintain spinal stability during the healing process.
Question: how are thoracic spine injuries managed? Answer: thoracic spine injuries may require immobilization, surgical stabilization, and rehabilitation to optimize function and prevent complications. Question: what are the signs of cauda equina syndrome?
Answer: signs include bilateral lower extremity weakness, saddle anesthesia, urinary retention, and bowel incontinence, indicating compression of the cauda equina nerve roots.
Question: what is the role of decompressive surgery in spine injuries?
Answer: decompressive surgery aims to relieve pressure on the spinal cord or nerve roots, often performed in cases of spinal cord compression due to trauma.
Question: how are lumbar spine injuries managed?
Answer: lumbar spine injuries may require immobilization, pain management, and physical therapy to optimize recovery and functional outcomes.
Question: what is the purpose of spinal stabilization surgery?
Answer: spinal stabilization surgery aims to restore spinal alignment, stability, and relieve pressure on neural structures.
Question: what is the role of minimally invasive spine surgery?
Answer: minimally invasive techniques reduce tissue disruption, postoperative pain, and promote faster recovery in spine surgery.
Question: what is the significance of sacral spine injuries?
Answer: sacral spine injuries can affect pelvic stability, bowel, and bladder function, as well as contribute to lower extremity motor deficits.
Question: how is autonomic dysreflexia managed in spinal cord injury patients?
Answer: managing autonomic dysreflexia involves identifying and removing triggers, along with interventions to lower blood pressure and prevent complications.
Question: what is the role of rehabilitation in spine injury management?
Answer: rehabilitation focuses on maximizing functional recovery, mobility, and independence through physical therapy, occupational therapy, and adaptive strategies.
Question: how are spine fractures treated conservatively?
Answer: conservative treatment involves immobilization, pain management, and monitoring for complications.
Question: what is the role of interventional pain management in spine injuries?
Answer: interventions such as epidural injections, nerve blocks, and radiofrequency ablation can provide effective pain relief in certain spine injury cases.
Question: what is the significance of spinal cord contusion injuries?
Answer: spinal cord contusions involve bruising of the spinal cord tissue and can result in temporary or permanent neurological deficits.
Question: how are spine fractures treated surgically?
Answer: surgical treatment involves internal fixation with hardware, bone grafting, and spinal fusion to restore stability and promote healing.
Question: what is the role of neuroprotective measures in spine injuries?
Answer: neuroprotective measures aim to prevent secondary injury mechanisms that can worsen neurological deficits after the primary spine injury.
Question: what is the significance of cervical spine instability?
Answer: cervical spine instability can lead to spinal cord compression, neurological deficits, and require surgical stabilization.
Question: how are spine injuries managed in the elderly population?
Answer: managing spine injuries in the elderly involves considering comorbidities, bone density, and functional goals in treatment decisions.
Question: what is the role of corticosteroids in spinal cord injury management? Answer: corticosteroids may be used to reduce spinal cord edema and inflammation in certain cases of spinal cord injury. Question: how are spine fractures managed in pediatric patients?
Answer: pediatric spine fractures require careful assessment, immobilization, and monitoring of growth-related complications.
Question: what is the significance of vertebral artery injuries in cervical spine trauma?
Answer: vertebral artery injuries can result from cervical spine trauma and lead to stroke or neurological deficits if not promptly managed.
Question: how are complications like deep vein thrombosis prevented in immobilized spine injury patients?
Answer: measures include early mobilization, prophylactic anticoagulation, and mechanical devices to prevent deep vein thrombosis.
Question: what is the role of bone health assessment in spine injury patients?
Answer: assessing bone health helps identify osteoporosis or low bone density, which may impact fracture risk and influence treatment decisions.
Question: what is the significance of spinal epidural abscesses?
Answer: spinal epidural abscesses are rare but serious infections that can lead to spinal cord compression and require urgent surgical drainage.
Question: how are spine injuries managed in athletes?
Answer: athletes with spine injuries require specialized management that balances the need for recovery with the goal of returning to sports safely.
Question: what is the role of psychological support in spine injury rehabilitation?
Answer: psychological support helps patients cope with the emotional challenges of spine injuries, promoting mental well-being and overall recovery.
Absolutely. Here are more questions and answers about spine injuries. Question: what is the significance of spinal cord concussion? Answer: spinal cord concussion is a temporary loss of spinal cord function due to trauma, often resulting in transient neurological deficits. Question: how are spine injuries managed in patients with multiple trauma?
Answer: in patients with multiple trauma, spine injuries are managed within the context of overall trauma management, ensuring timely stabilization while addressing other injuries.
Question: what is the role of early ambulation in spine injury rehabilitation?
Answer: early ambulation helps prevent complications like deep vein thrombosis, promotes muscle strength, and accelerates the recovery process in spine injury patients.
Question: how are spine injuries managed in patients with spinal cord injury-induced autonomic dysfunction? Answer: managing autonomic dysfunction involves addressing issues like blood pressure control, bowel and bladder management, and preventing complications like autonomic dysreflexia. Question: what is the significance of posterior ligamentous complex injuries in spine trauma?
Answer: posterior ligamentous complex injuries can result in spinal instability and require careful assessment and appropriate surgical intervention.
Question: how are spine injuries managed in patients with ankylosing spondylitis?
Answer: ankylosing spondylitis complicates spine injury management due to altered spinal anatomy and fragility, requiring specialized approaches to treatment.
Question: what is the role of neurosurgery in managing severe spine injuries?
Answer: neurosurgery may be necessary for decompression, stabilization, and repair of spinal cord injuries to prevent further damage and promote recovery.
Question: how are spine injuries managed in patients with spinal infections?
Answer: in spinal infections, a combination of medical treatment, antibiotics or antifungals, and potentially surgical intervention is required to eradicate the infection and stabilize the spine.
Question: what is the significance of vertebral body augmentation in spine injury management?
Answer: vertebral body augmentation techniques, like vertebroplasty or kyphoplasty, can restore vertebral height, alleviate pain, and stabilize fractures.
Question: how are spine injuries managed in patients with spinal tumors?
Answer: management involves addressing both the tumor and the associated spinal instability, often requiring a combination of tumor resection and spinal fusion.
Question: what is the role of traction in managing certain types of spine injuries?
Answer: traction may be used to reduce spinal deformities, align fractures, and provide temporary stabilization in certain spine injury cases.
Question: how are cervical spine injuries managed in pediatric patients?
Answer: pediatric cervical spine injuries require careful assessment, immobilization, and monitoring to avoid potential neurological deficits or growth-related complications.
Question: what is the significance of vertebral artery testing in cervical spine trauma?
Answer: vertebral artery testing helps identify vascular injuries that can occur during cervical spine trauma, aiding in timely intervention to prevent complications.
Question: how are spine injuries managed in patients with osteoporosis?
Answer: management involves considering the fragility of bones, using gentle techniques, and prioritizing fracture prevention in patients with osteoporosis.
Question: what is the role of electrical stimulation in spinal cord injury rehabilitation?
Answer: electrical stimulation can help improve muscle function, prevent muscle atrophy, and enhance neuroplasticity in spinal cord injury patients.
Question: how are spine injuries managed in patients with rheumatoid arthritis?
Answer: managing spine injuries in rheumatoid arthritis patients requires addressing underlying joint inflammation, instability, and the potential need for surgical intervention.
Question: what is the significance of spinal epidural hematomas?
Answer: spinal epidural hematomas are rare but can lead to spinal cord compression and require urgent surgical evacuation to prevent neurological deficits.
Question: how are spine injuries managed in patients with degenerative disc disease?
Answer: management involves addressing both acute injuries and chronic degenerative changes, often requiring a combination of stabilization and pain management.
Question: what is the role of bone grafts in spinal fusion procedures?
Answer: bone grafts promote spinal fusion by providing a scaffold for new bone growth, stabilizing the spine, and enhancing healing.
Question: how are spine injuries managed in patients with ankylosing spondylitis?
Answer: ankylosing spondylitis complicates spine injury management due to altered spinal anatomy and fragility, requiring specialized approaches to treatment.
Question: what is the significance of neurogenic bladder in spinal cord injury patients? Answer: neurogenic bladder is a common complication of spinal cord injury, requiring management to prevent urinary retention, infections, and kidney damage. Question: how are thoracolumbar spine injuries managed?
Answer: thoracolumbar spine injuries may require surgical stabilization, spinal fusion, and rehabilitation to optimize function and prevent complications.
Question: what is the role of spinal cord monitoring during spine surgery?
Answer: spinal cord monitoring involves assessing electrical activity during surgery to detect potential spinal cord damage and guide surgical decisions.
Question: how are spine injuries managed in patients with ankylosing spondylitis?
Answer: ankylosing spondylitis complicates spine injury management due to altered spinal anatomy and fragility, requiring specialized approaches to treatment.
Question: what is the significance of spinal infections in trauma patients?
Answer: spinal infections can complicate trauma cases, requiring prompt diagnosis, appropriate antibiotics, and potential surgical intervention.
Question: how are thoracolumbar spine injuries managed in pediatric patients?
Answer: pediatric thoracolumbar spine injuries require careful evaluation, immobilization, and monitoring of growth-related complications.
Question: what is the role of regenerative therapies in spine injury management?
Answer: regenerative therapies, such as stem cell treatments, hold promise in promoting tissue healing and functional recovery in spine injury patients.
Question: how are spine injuries managed in patients with congenital spinal deformities?
Answer: managing spine injuries in patients with congenital deformities requires addressing the existing deformity while stabilizing and treating the injury.
Question: what is the significance of vertebral artery testing in cervical spine trauma?
Answer: vertebral artery testing helps identify vascular injuries that can occur during cervical spine trauma, aiding in timely intervention to prevent complications.
Question: how are cervical spine injuries managed in the elderly population?
Answer: managing cervical spine injuries in the elderly involves considering bone health, frailty, and potential surgical risks.